Do good work is not a label, but a way of living. It is the constant and diligent effort to achieve a new level of excellence in one's own life. It is the hidden inner beauty behind the struggle to achieve excellence. It's not perfect, but imperfect. It is the effort, discipline, and focus that often goes unnoticed. The goal of Do Good Work is to highlight that drive. The guests I have on this show emulate this drive in their own special way. You'll be able to apply new ideas into your own life by learning from them. We will also have one-on-one episodes with me where we'll dive into my own experience with entrepreneurship and leadership. Every episode is designed to provide you with ideas that you can apply and grow in excellence in all areas of your life, business, and career. Today on the show, we have Dr. Laura Gardner. She's the founder and CEO of Persimmon AI, a healthcare startup that is on a mission to tackling the issue Americans and new arrivals in the U.S., such as immigrants, students, temporary workers, and vacationers, face when they get overwhelmed by the number of over-the-counter medications available to them. Her proprietary OTC Finder, or over-the-counter finder, helps both USA-born and new arrivals translate their home over-the-counter medications with a matching over-the-counter medications at their traveled country. Prior to founding Persimmon AI, Dr. Gardner was president and medical director of Axiomedics Researching, a research consulting and software development firm founded in 1994 with a focus on predictive modeling of health outcomes. Well, Laura, thank you so much for being on today.
Happy to be here.
Laura, I'd like to dive into your current venture, Persimmon AI, and I want to learn a little bit more your backstory of why this company right now.
The process of coming up with the idea that Persimmon AI is pursuing, which is a translation service for people who are looking to find the right over-the-counter medications. This came up in the process of brainstorming ideas with a person who I had actually sponsored as an intern. So going back to the origins of Persimmon AI, we started in January of 2019. And I started by sponsoring an internship because I thought I didn't have an idea for a product. I wanted help getting inspired and coming up with a good idea. And I thought that sponsoring an internship for some young people with some market research experience, some people who could help me pursue ideas in the pharmaceutical sector, that's sort of where I wanted to focus, but I just didn't know exactly what to focus on. And long story short, the internship was a pretty good experience for the 3 interns. They learned a lot. They had weekly readings, a weekly speaker. So they all felt that it was a good experience, but the goal of coming up with a product idea was unfortunately not met. And so the internship ended in June of 2019, and I was just making connections with people in the industry and doing some small consulting projects, all the while turning my mind to what might be a good product idea, what might be something that I could invest my time in. And in December of 2019, one of my 3 interns from the previous spring came back to me and said, look, I really think we will come up with a good idea if we brainstorm together. Mm-hmm. So we got together in January of 2020, and the first idea out of his mouth just grabbed me. And it was the idea for OTC Finder. And I really just immediately saw the promise in helping new arrivals to this country, which the immigration issue in our country is complicated right now. But I think looking in not just the long term, but even in the near to medium term, I think that that situation is going to improve. Hopefully, with a new administration, there will be some more humane immigration policies, and this population will only grow in our country, which is why I'm serving it and meeting the needs of the new arrivals in this country just seemed like a fabulous idea to me. So that's how we came up with the idea. Since working on it, we and developing, projections around how many people would be interested and who would sign up and how much would they pay and that sort of thing, we realized that there's actually a double market out there for what we're offering. And the new arrivals in this country are definitely the primary market, I might say, but we expect to have a wide array of countries in our database when we're finished developing the database. And we realized that Americans traveling abroad was a parallel market that we could easily serve by having the search process go from any one country to any other country. So while we're starting out with a limited number of countries, we expect to expand globally and serve the needs of U.S. citizens who are traveling abroad, as well as immigrants and temporary workers and students and visiting professors who come to the U.S.
No, I love that. And the fact that you're focusing on two different serving a similar desire or need of traveling, moving, and also getting the right medications depending on, like you mentioned, translating. And one of the things that I am very curious to learn a little bit more about the way that you structure, the way that you think in regards of business is how do you view IP and how are you setting up IP protection for Persimmons as you get ready to go to market, like you did in your previous company?
Well, we are starting out very vested in getting people to sign up and use the product. We're not going to be charging for it initially, probably not ever. We'll be charging instead for premium features or an expansion of the country database. But to just jump in and use the product, it will be free initially, and the IP that we're providing is invested in our database and the work that we've done building up the database. In addition to that, we are also developing an artificial intelligence prediction algorithm that will be part of our IP and will take the place of the hand-to-hand matching that we did for the beta version. So for the beta version, I personally hand-matched every drug in the database from the away country to the US. And you can imagine that was a pretty tedious
time-consuming.
Based on my experience with AI, I'm confident that we can develop an AI algorithm that will take the place of the hand matching, and that will become part of our IP. So you're right. I look to my startups as a rich source of IP, and that becomes something that is attractive to not just potential acquirers, but even before we reach that point, there are a lot of potential partners out there who are attracted to the IP and to be a part of it.
And I wanted to highlight that because I do love the way that you think about it. It's not only providing a service that solves a real issue right now within travel or immigration, but you're also looking at it from a strategic point of view and looking at your product. It's a product service as a product. How can I create IP in regards to make this not only attractive as we grow, but even potentially down the line? And I really do like the fact that you're focusing on that at a strategic level. And I do want to dive into two different avenues here, one in the AI avenue and one speaking about your experience with strategic sales of IP. But I really want to dive into For those founders who are listening right now who may know the value and the use case of AI, can you walk us through in regards to how your team is developing its own AI algorithm and some share or experiences that you can share to other founders when they're looking to travel down this path?
My team is developing the AI algorithm by first collecting uh, a nice body of data. And I'm not sure if one can even develop an algorithm without data.
Mhm.
Data has been the meat and potatoes of all of the AI work that I've done.
Mhm.
You need real usage data to figure out what choices people are going to make when they use your software, which screens they'll click on, which choices they'll make, and developing that algorithm then is based on analyzing the actual data to
Mhm.
develop an ability to predict what should be presented to the user as a choice in the future. So I would say to anyone interested in incorporating AI into their offering, um, the first step is to have a rich body of data and have it be real time, real situation data so that you have a good foundation on which to rest a predictive algorithm. Given that you develop the data, the next most important thing is to have somebody, either an individual or a team, who has experience developing AI algorithms,
Mhm.
because it's not something just anyone can do. And you want it done right and you want it done successfully. And the best way to do that is to work with someone that has the experience. In our case, that person is me,
Mhm.
although for sure I will be sharing the algorithm with trusted advisors to get their input. And those advisors include AI experts as well as clinicians and medical doctors and people in the community that we're trying to serve.
And so I like them when you mentioned earlier in regards to having the quality data and it has to be in real time and based on the specific situation or area that you're looking to analyze. How do you go through a cleansing of the data and ensuring that this is quality data that is worthwhile going into your database? Do you do a lot of research in regards to that? Do you always correspond with different sources to qualify the data? What's your process like?
Well, we've been collecting the usage data now for a couple of months from people who we've identified as being in our target market.
Mhm.
And we have done this by developing relationships with these people. So we have almost 100 people on what we call our user council.
Hmm.
And these are people who have seen the product, seen what it can do, and are willing to serve essentially for free as advisors to us. Uh, it's it's not completely for free because we promised each of them the use of the product for free for life.
Mhm.
So that's a nice compensation for anyone who can see the value of the product.
Mhm. No, no, and I love that, and the fact that it's real time. How do you incorporate real time? Is it because you're always gathering data at a specific touch point within your users, or is it syncing to a separate feed, or how do you incorporate real time into the data?
Well, right now, real time is pretty much the only way we can get usage data because we haven't launched yet.
Mhm.
Products in development with launch scheduled in about 2 weeks. For the end of the first week of November, we hope to be launching. But right now, it's not available to just anyone. We have to invite people to come on and use it with us over Zoom. And so we serve as both a guide as well as a witness to how they use the product, how they search, what they look for, how satisfied are they with the results. Do they use all the features of the product, including the journaling feature? Things like that. So
Mhm.
we're sitting there with them, almost like we're sitting shoulder to shoulder,
Mhm.
watching how they use it, guiding them, and collecting the data that way.
That's perfect. And one of the things that, you mentioned earlier on is taking the data, creating the algorithm in order to present the right choices to your users. And one of the things that, in our interactions that you mentioned is the balancing between the right things, or the right way of doing things versus the actual right things to do. Can you talk to us a little bit more about that balancing act?
It's interesting that you bring that up because that's actually what you just said is something I have heard in the past as being the way to tell the difference between a manager and a leader.
Hmm.
And so what I've heard is uh, a manager does things right, but a leader does the right things.
Hmm.
And so what we're looking for when we gather gather usage data from our users is, are we serving them well in both regards? Are they able to do the right things with our product? And as they use the product, are they able to do each thing right? So is the product clear? Are the instructions clear? Do we need a pop-up explaining something that maybe there are things in the product that are so familiar to us that we don't realize that they're not well known to our users.
To the UX, yeah, the user experience there. And I like that you distinguish that leaders versus managers, doing the right actions, but actually, if they're out of sync, it doesn't matter because it's always looking at your users first and making sure that they're taking the correct actions and then doing them correctly.
Exactly.
I love that. I love that perspective. But I'd like to shift gears, Laura, and learn a little bit more about your history, like your founder story with Axiomedics research and how you developed IP in a format that you were able to strategically exit. Can you share with us a little bit more about that story?
Sure. So I started what was essentially a research and consulting firm 20 plus years ago. Things were good for me from a consulting perspective for quite a few years. I was getting projects mostly through word of mouth, and the projects were going well. I was making good money. But I got to thinking that I wasn't creating anything that had lasting value. I was especially perturbed by the fact that a lot of my projects would result in a final report that I would give to the client. They might flip through it, they might not, they would put it on a shelf and forget about it.
Hmm.
And it was frustrating, but for many years I just accepted that that was the typical fate of a project. It would
Hmm.
end up in a final report and not provide lasting value. And it was troublesome to me, and I started thinking, how can I change this? Because I really want to create something that will live on after I'm done with the project. And so I realized that it was the format that was causing the trouble. It was
Hmm.
the physical printed report that was not getting enough page views, not getting enough circulation. And I realized that to get those additional views and to get widely circulated, what I needed to create instead of a report was something interactive,
Hmm.
something. And so my first thought was not about AI or anything like that. It was more that I wanted to create something that the user could interact with. And so instead of me handing a report where I compared, let's say I compared doctors working in a PPO with doctors working in an HMO, there are a lot of interesting sub-analyses that can be done. What about female doctors versus male doctors? What about uh, rural doctors versus urban doctors? And so the more interested clients would often say to me after getting my report, this is great, but can we also analyze X?
Hmm.
Can we also look at it from this other perspective. And so I realized that if I gave them the tools to do that, it would save me a lot of effort and a lot of reprinting of the report.
Hmm.
And so my initial IP, if you want to call it that, was simply an Excel pivot table
Hmm.
with the results and data that I had been given. And the pivot table allowed the clients to try these different viewpoints. So it allowed them to sub-analyze by all the different variables that we had. And that was my IP for several years. And I had some very loyal clients who I thank profusely for sticking with me. But I realized after a few years of coaching clients through how to use a pivot table that I still wasn't at the sweet spot of something that anybody could use to gain insights and generate knowledge from the data. So that's when I teamed up with another company to develop the products, the two products that I had invented um, in a professional software development way.
Hmm.
And this company, which I joined as a VP of products and later was promoted to chief scientist in order to help develop my products, they got it. They understood what needed to be done to make the products more useful, more general, more exciting for people. And so they teamed up with me. I provided the IP, they provided the software development shop, and they are now marketing the products and doing very well.
And I want to take out some of the principles from that journey, and I really appreciate you sharing that because this highlights a lot in regards to an entrepreneur being able to care about the work that you do and its end use. And you saw that the end use wasn't being fully utilized, and you weren't making the impact that you know you could make. So actually caring and trying to figure out how you can better serve your clients kind of forced you into creating your initial IP. And it even goes further when we talked about when you talked about creating software around it, just repackaging that IP in a more user friendly, knowledge gaining to get more insights, really to be able to take action based on information. And for our listeners out there, I think it's important to look at what's the work that you're actually doing, what work that you're doing that matters, and how are you getting that work out there, and is it being fully utilized to the extent that you know it can be, or that your users ask of you. Because I know, Laura, you mentioned that some users like, oh, can I look at this access or this different data point? So being able to get market feedback, and how do you create a stronger impact with the work that you do by either repackaging or creating a new delivery method so that your users can really fully utilize the good work that you're doing there. But Laura, I think moving forward, any updates in regards to where we're at on the launch of Persimmon? I know that this is exciting to see when your first launch date's going to be, and any initial user feedback from what you've been developing.
Yes, we've been getting a lot of user feedback. Like I said, we've got close to 100 people on our user council, and the majority of them are in our precise target market for the launch. We're
Mhm.
focusing, our first translation is on people coming from India and looking for the medications they were used to back home.
Mhm.
And we expect to launch that service in early November. And then our very first upgrade is going to follow shortly after that, where we do the reverse translation. So travel may be an issue right now. We understand that. But there are people who are traveling now, and there will be people traveling again.
Mhm.
I'm confident that as a country, we will surmount the COVID crisis and go back to leading almost normal lives. So we're counting on that. We're counting on people traveling again. And so our very first upgrade is going to do the reverse translation for people who travel to India and maybe are looking for the medicine they're used to from back in the US. And then we're going to be quickly adding more countries. So focus on Mexico and Central and South America, and then ultimately the EU, Asia, and Africa. So we have big plans to expand globally and to serve people going both directions.
And I know that you're going to continue to create that impact because this is a real, I mean, seeing it for myself here in San Diego, I know we have a lot of like our tech valley or our little mini Silicon Valley over here, if you want to call it, in Sereno, and a lot of travel, a lot of different workers coming in and out specifically for these tech companies. So I know the work that you're doing is definitely going to make an impact there. But Laura, for every one of our listeners here, what's the best way to thank you for being on today and connect with you?
Well, to thank me, the golden touch for me right now is to get people to give me their feedback on the product. So anybody who wants to sign up to get a demo, they can contact me through LinkedIn. I answer every DM right now. I get 25 to 30 a day, and it takes up a nice fraction of my day just getting back to everyone, but I do answer everyone right now. And anybody who's interested in getting a demo, it's free. It takes less than half an hour by Zoom to walk you through it. And then you can agree or not agree to be on our user council, and everyone on the user council will get the product immediately on launch, and they will have it for free for life, even if at some point we start charging for premium features or for expanded access to different countries.
It's extremely valuable. So I'll put the link to both Persimmon AI as well as your LinkedIn profile, Laura. And Laura, thank you so much for being on again.
Thank you so much for having me.